What if I told you your back pain isn't what you think? Did you know that nearly 80% of adults experience back pain, but most never discover the real cause? And here's the shocking part. The problem might not be your muscles. Stick with me to uncover the truth about your back pain and a revolutionary treatment you've likely never heard of. Hi, I'm Dr. John Zalanka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Back pain is one of the most misunderstood conditions out there. Too many people are stuck in a frustrating cycle of therapies, medications, or injections without lasting relief. In this video, I'll reveal the 5 most common spinal disorders that often go undiagnosed and explain how they can cause not just back pain, but also sciatica. Plus, I'll introduce a breakthrough treatment with a 90% plus success rate that's non-surgical and safe. And if you're curious about learning more, I have playlists for each of these conditions linked in the description. Let's face it, there are a lot of myths about back pain, especially online. A lot of people think that because this worked for my back pain, I'm going to sell it to the world. That can sometimes work, sometimes be dangerous. Right? People often also assume it's caused by poor posture, heavy lifting, being overweight, or simply getting older. And while these factors can play a role, they're rarely the whole story. For example, poor posture can definitely contribute to back pain, but the key is understanding how it affects your back. Poor posture can lead to extra stress on the spine, damage to spinal structures like discs and joints, and ultimately chronic pain. Addressing posture isn't just about standing up straight, it's about identifying how it's impacting your lower back and creating a plan to fix it. Back pain isn't just about physical strain, it's the result of a combination of factors. Yes, prolonged sitting and lack of exercise are major contributors, but did you know that stress and emotional health can amplify your pain? It's not just in your head. Stress can tighten muscles and increase inflammation, making everything worse. And here's the kicker. Many people have underlying spinal issues they don't even know about. That's why traditional therapies like medication or stretching often fail. They don't address the root causes. But stay with me because I'm about to break down the 5 most common spinal disorders that could be behind your pain. Here's the game changer. Chronic back pain is often rooted in spinal disorders that go undiagnosed or untreated. These conditions not only cause pain, but can also lead to nerve compression, sciatica, and long-term damage. And the good news, there's a way to treat these disorders effectively without surgery. Let's explore each condition and how they're connected to your pain. And remember, if you want to dive deeper into any of these topics, I've created in-depth videos for each disorder. Check the playlist in the description. Number 1, let's start with disc herniation. So a herniated disc occurs when that soft gel-like center of that spinal disc actually pushes through its tougher outer layer. So think of this like a jelly donut. If I squish too hard on one side of the jelly donut, the jelly is going to push back out the other side. So this compress, we can actually see this right here. You'll take a nice close look. You've actually got that disc herniation or bulge or prolapse or protrusion, all variations of essentially the same thing with some minor differences. This compress on nearby nerves, causing sharp pain, numbness, or weakness in the back, and even down the leg. It's going to affect wherever that nerve goes to. So if it's in the lower back, it's going to go down the leg. That's what many people know as sciatica. In my playlist, I dive into how herniated discs are diagnosed and treated, so don't miss it. Number 2 is spinal stenosis. So what spinal stenosis is, it's a narrowing of the spinal canal. So same thing as if we look at the model of the spine. Remember, the spinal canal is actually where the spinal cord itself is going through. So when that spinal canal narrows, it puts pressure on the entire spinal cord and hence can affect the nerves that come off that. This condition can cause pain, numbness, or a tingling sensation that worsens, especially when standing or walking. It's often misdiagnosed as simple aging, but the right treatment can make a huge difference. Number 3 is what we call foraminal stenosis. So again, stenosis just simply means narrowing. So now, not like a spinal stenosis where we narrow the actual spinal canal. Now we're actually narrowing what's called the foramen. So the foramen is that opening or passage where that nerve actually comes out. So what we're getting is it's going to involve that narrowing and where those nerves exit. So that's going to lead to sharp radiating pain down the arms or the legs, down the arms if it's the neck, down the legs if it's the lower back. It's a common cause of sciatic pain and often goes undetected in standard exams. Then there's spinal arthritis, also known as degenerative disc disease or osteoarthritis. These are wear and tear conditions that can cause inflammation and loss of cushioning between the vertebrae, leading to chronic pain and stiffness. So we can see on the model here, again, we want that nice thick disc. First, that disc starts to wear and tear, thin out. When it does that too much, you're actually going to create the body's going to create what we call spurs or osteophytes. It's actually trying to fuse the vertebrae together. and that's your end stage where the vertebrae in fact have fused together. So over time, that degeneration is going to irritate nearby nerves, making activities like bending or twisting almost unbearable. I have an entire video series on this condition, so please be sure to check it out for detailed solutions. Last but not least, we have what's called spondylolisthesis. So this occurs when one vertebrae essentially slips out of place. I almost hate to use that term because people use the term slip disc. There's really no such thing as a slip disc. But what happens is one vertebrae is actually going to shift forward on another. And it can either shift forward or backwards. That's why we call it either anterior listhesis if it's forward, retrolisthesis if it's back. But once we shift like that, we're now going to, again, tense not only that nerve, but we can also tense the spinal cord inside of that as well. That's going to lead to instability, nerve compression, persistent pain. It's one of the most overlooked causes of chronic back pain and sciatica. If you want to learn more, check out my playlist dedicated to spondylolisthesis, anterior listhesis, and retrolisthesis. Now, if you're dealing with one or more of these spinal disorders, there is hope. A cutting-edge treatment called non-surgical robotic laser spinal decompression has been shown to have a 90% plus success rate. This advanced therapy gently decompresses the spine, reducing nerve pressure and promoting healing, all without surgery or downtime. It's a game changer for anyone tired of living with back pain, and here's how it works. Non-surgical robotic laser spinal decompression uniquely combines two well-researched therapies, spinal decompression and class 4 deep tissue laser therapy, that occur at exactly the same time. It's this integrated approach which is facilitated by a specialized patented decompression system. We have the only system in Ottawa, Ontario, and one of just 12 systems worldwide. Spinal decompression gently decompresses the spine to alleviate pressure on those discs and those nerves, and it's going to promote nutrient-rich fluid flow into the disc. It's actually going to help to rehydrate the disc. This promotes disc healing, repair, and that rehydration is what's going to help. A normal disc should be 86% water. Most people's discs are no longer 86% water, and unfortunately, just drinking more water does not get that fluid back into the disc. You need that decompression at the exact same time. Class 4 laser, which is the highest level of laser approved by Health Canada and the FDA, has been shown to reduce inflammation, enhance blood flow, and relax muscles, making it an effective treatment for promoting long-lasting healing and pain relief. Combining these two therapies boosts their impact and helps you recover faster. This dual action method is among the most advanced non-surgical treatments for chronic back pain caused by disc herniation, spinal stenosis, foraminal stenosis, spinal arthritis, degenerative disc disease, and spondylolisthesis. By addressing both structural compression and inflammation at the same time, non-surgical robotic laser spinal decompression provides a comprehensive solution for lasting relief. Chronic back pain doesn't have to control your life. By understanding the true causes like herniated discs, spinal stenosis, degenerative disc disease, and more, you can finally find relief. And with treatments like non-surgical robotic laser spinal decompression, there is a proven solution. Don't forget to check the playlists in the description to dive deeper into each of these spinal disorders. If you found value in this video and learned something new about the treatment of chronic low back pain, please like it and please share it. Also leave a comment and let me know which lower back spinal condition you're dealing with. And don't forget to subscribe if you're looking for more proven tips and strategies to treat and relieve debilitating back and neck pain without relying on drugs or surgery. If you want to hear 3 incredible patient stories about how non-surgical robotic laser spinal decompression changed their lives and gave them lasting relief, I've put them in a playlist for you. Please check it out now.